I've spent more time than I care over the last month or so talking to you about hugely operational issues, which clearly are really, really important. And a number of you were at the event we had at Church House a few weeks ago, and I won't repeat that. You all know about the issues we currently face. But we all know, in every one of those meetings that we've had, we end up in a place where we're trying to fix something, where actually the system needs to fundamentally change. And that's where we want to focus today. Three things. One is the opportunity that the London Health Commission presents to London. We have a unique opportunity. No other part of England has its mayor championing health in that way. How do we, as the collective leadership in London, want to take that forward? How do we want to seize that opportunity? And a big theme of the London Health Commission, I'll say more about this in a moment, was the particular way it engaged Londoners in a way we just haven't done in health and care before. So thousands and thousands of citizens of this city were engaged in a debate about their health, about their care, about the wider determinants of health, and a conversation which we really, really need to think about how we're going to build on that and really engage people in the sorts of changes we want to see. So, as Mike said, two important documents which came out in the last month or so. First of all, the 5-year forward view. A number of you will have heard Simon talk about that, Simon Stevens talk about that a week or so ago when we met. An important document. It set out what are the challenges. I think a number of us would say we recognise those, but then went on and said, so what might you do about them? What are the models of care? And how might you change the way you commission care? How might you incentivise, change incentives in order to support? And it started a national debate. And one of the things we will be tasked with in London is how do we make the vision that starts to be formed in that document a reality in London. And then Better Health for London, which I would argue there's a huge alignment between those documents. So Better Health for London, very, very strong focus on engaging Londoners and their promoting health and well-being. Huge number of recommendations in that regard. But also a huge number of recommendations about children, some very compelling evidence about our children in London and what we need to give them the best start in life. And then went on to talk about how we should transform care in London, and probably most importantly, talked about some of the hows. And we're going to spend some time today unpacking that. But a lot of we've often talked about the what in London, what we want to achieve in terms of better health for Londoners, what we want to do to transform care. But often it's been the hows, the estate, the incentives, etc., that we haven't been able to unlock. And I think that's where the Health Commission will really help us. So I just want to say something here about the engagement. And the reason I want to just talk to you about this is because to give you a feel for the scale of the engagement that happened across London as part of the 12 months of the Health Commission, the numbers of people we touched, and therefore the numbers of individuals, communities that are wanting to engage with us in the journey of transformation across London. So you can see 15,000 people were involved. There were events in every borough. There were submissions and calls for evidence, and people might have seen, if you go onto the Commission website, you can see a summary of all the calls for evidence and what people actually said. You can also see the videos of what people said. There were road shows, and there were, importantly, oral hearing sessions. So thousands of people across London gave their views about how they would like to see care transformed. And I think now we've got a video which will show you a little bit about that.
A healthy London for me looks like a place where, when we're feeling alone, we can connect with other people and share our experiences with other people.
Where young families would want to raise their children, where older adults, when they move to retirement, would want to stay because it's a place where you can get out in the streets and move around safely.
Full of people who are able to enjoy life to the fullest, regardless of their background or their socio-economic position.
The Mayor needs to deal with the proliferation of fast food outlets that we've got, betting shops, and the way that alcohol is licensed and promoted.
It's very easy, particularly for people on low incomes, to choose unhealthy options for meal times because it is so much more economical than going to a supermarket and buying healthy options.
One thing that can make young people healthier is to know what they're eating, to make them aware about cooking and things that they're putting into their food.
Sometimes people don't really understand that they need to eat healthy until something life-threatening happens to them or someone around them.
I think the one thing that would make young people healthier is that if we were actually teaching them something that they actually understood and that's related to their lives in our curriculum when we're teaching it to them.
People should laugh more, smile more. It's healthier for your body. And to walk a lot more, do more exercise and eat healthy.
I think if maybe between tube stations you were actually told the distance it would take to walk.
Do something about cleaning up the air in London and do it fairly quickly.
Air pollution, well, it should be improved so we could travel to central London and without worrying about that.
Well, I think there's still too much smoking, so that's something that needs to be addressed. I think just ban all smoking on the streets, really.
Let's be the city that leads mental health and good mental health.
It's really easy to recognise the people who will become socially excluded. I can go to a nursery down the road and I will tell you who's going to be in Providence Row in 30 years' time.
We need more access to gym facilities. They need to build on what they did with the 2012 Games, get more schools involved in sport, after school clubs, making sure there's healthy fruit for young children, putting on more clubs and sports where possible.
It's absolutely vital that we take responsibility for our own health. And also I will go further to say that once we've done that, we can also seek to become more involved in the way in which health services and care services are shaped and planned.
The access to general practice in London isn't as good as we'd like it to be. And also we know that, in fact, you look at the studies, if you've got good access to your general practitioner, you have less use of A&E, you're admitted less, you attend less, and your patient outcomes are better.
The 20th century was a century of evidence-based care. The 21st century is a century of personalisation. It is about the people themselves.
It's a time for generalists now. People have a responsibility across a range of issues. No longer can we deal with a specific illness. You need to deal with the whole person and you need to deal with the family behind that. And for us, that's the integrated care.
Help for
facilitate the relationship that the private sector, the public sector and the voluntary sector have together. Only by solving problems together will they actually make any long-term behavioural change.
The academic health science centres and their networks are critically important, but there's got to be someone who brings them together.
It's going to require an awful lot of people, a lot of stakeholders to work together to actually change things and improve the health of London.
So I like that video because it gives you a feel for the wide range of people who engaged, and they've all got a view about what they'd like to see. They've got a view about how they'd like to be involved, and I think have an ambition to create this as the healthiest city in the world. And indeed, if you've read the report, that was the goal that Lord Darcy set for the Mayor, but also for us, to create London as the healthiest global city in the world, and that feels like a pretty good ambition. And I won't go through these, but if you haven't looked at these, there are 10 ambitions in the report. And if you only read one thing, this would be it, because this is about what we want to achieve by our collective effort. And I think what the Commission started to do was to create a sort of social movement, which we have an important role in galvanising and leading. But it is just that. It's not one organisation who can make this happen. It's a whole plethora of organisations and Londoners themselves. So I'll leave it there, and I think I'm handing over to Martin.
I won't need that. Thank you very much, Anne. I'm now trying to edit what I was going to say to take account of what I've just heard, which is always the trick, isn't it? But I think I'm really pleased to think there's a lot of commonality, both in Mike's introduction, what Anne said, what's on the video. So I'll edit as I go along. My opening point is that we are living in very sort of disruptive times, whether it's politics, democracy, technology, public finance, all facing certain amounts of turmoil and incredible uncertainty. But we know from both theory and experience that, of course, disruption creates opportunity for innovation and creativity. It enables things to happen that might have been conceived in more stable times but couldn't gain traction. So amidst all of that, and using some of the tools that people have already talked about, we do have an opportunity in London to do something different and to grasp the opportunities that the turmoil and some of the frameworks that have been spoken about give us. And I think it's up to us to do that, and I'll return to that right at the end. And in the world of health and social care, there's no shortage of advice on how to do, well, there is short advice on how to do it. There's no shortage of views on what the new model should look like. So since we last met in March, I think every think tank in the country has produced a report on health and social care. The Local Government Association has given its views, the NHS Confederation has given us its views, we've had the Barker Commission, and we've now had the NHS England Forward View, and we've had clearly a document designed specifically for London in the London Health Commission, and at the same time Public Health England have produced their report, which is called something like From Evidence to Action. I'm looking at Yvonne if I get that right. Now I think what's remarkable, what's already come out in what people have said, is amongst bodies with very different responsibilities and perspectives, there are some really common themes. So I think there's a great consensus in terms of what we need to do and what it might look like. And I'm going to just focus on 4. And the first is that sooner or later the funding gap that will persist beyond the financial dividend that we get from the various reforms we're going to do is going to have to be addressed. Now, I'm not saying that just to ingratiate an audience who will always want more money. And from my local government colleagues, we never get more money, so there's no real hope that we'll get more money, even if we ask for it. But the reason I say that is because I think otherwise there is a risk that worthwhile reform will be burdened with unreasonable, undeliverable financial expectation. And we won't do some of the things we need to do because the financial expectation on those things is too great. And I think we've already seen some of that with the Better Care Fund. I think some really good stuff stuttered a bit because the financial weight placed on some of the principles of the fund was just too great. The second is the very welcome focus on the health and well-being of the population and not the systems of health and social care. And I really don't think that would have been true 5 years ago. I don't think you would have seen the NHS 5-year forward view, but there are people in the audience who can correct me on this one, having as much emphasis on the health of the population as the publication that we saw a couple of weeks ago. And that's another thing that runs through all these reports. And allied to that, of course, is the need to work with our population, the importance of self-care, early intervention and prevention, which is already spoken about. The third thing I want to say, which I think is a common theme in these reports, is the re-emergence of what I think my health colleagues call population level commissioning, but I might have got that wrong, but what my local government colleagues call place-based commissioning. And they're basically the same thing, really. So I think there's a commonality of concepts and principles that are re-emerging across local government, across health, that will help us work together more productively in the future. And finally, and I would say this, wouldn't I, coming from local government, I want to highlight the growing tolerance and indeed encouragement for local variation and experimentation, albeit within certain parameters, because I think that's a really welcome development, and I think this is the only way that we will make the changes necessary. I've got 4 things for us to consider as leaders, and I mean us, literally the people here. And the first, again, echoes what's already been said. I think we should be applying our intellect to develop collaborative forms of leadership across organisations, functions, professional boundaries. I've said that before, I'll say it again. It's quite difficult managing our individual organisations, but we sort of know how to do that, really. I'm not sure we do know how to do collaborative leadership, and therefore I think we should apply our best brains to solving that particular problem. I think secondly, we need to constantly remind ourselves, and again this is the theme, that no matter how clever our planning systems, our commissioning systems, our payment mechanisms, the whole technocratic infrastructure that we do as professionals, we do not commission the 10 million people of London, and we never will. So we need to remind ourselves that technocratic solutions, however sophisticated, are not going to be part of the answer. But I am a pragmatist and I'm a practitioner. And I'm also a child, like many of you in the room, I think, of the performance management era. When I first started work, there wasn't performance management in the sense of that, but now I can't see how we would live without it. And it has a profound impact on our individual actions and behaviours and those of our organisations. And I think we need to work in London to align our performance management systems, notwithstanding the various influences on them from other places and other bodies. And I think we could do a lot worse than adopting the 10 aspirations set out in the London Health Commission and place those at the top of our performance management pyramids. It would help us work to some common goals, and it would be a really symbolic act in terms of showing collective leadership across the capital. And then finally, where I came in really, although I've got one codicil, I think it's really up to us. I don't think anyone knows how to do this, because if they did, they'd have done it already. So I think we need to take advantage of the work of the Commission, of the 5-year forward review, of all the other documents, as well as our own understanding, to develop solutions for London and parts of London, and most of all to develop solutions that benefit Londoners. I'm going to finish with one, because none of that was based on evidence, just opinion. But I'm going to finish on one factual note. The Better Care Fund will have touched all of you in one way or another, some better, some worse, I suspect. We now know the results of the national moderation. What you might not realise is that half of the fully approved Better Care Fund plans in the whole country are London plans. And 85% of London's plans are in the top 2 categories of ranking, or whatever you might call them. 85%, and that compares to 60% in the rest of the country. Now, I am competitive, so I like London being better. But my real point is, I hope that that's a product of some of the collaboration and working together we've already done. And I think it could give us some inspiration to do more together, because I think we can deliver a great deal more for Londoners. Thank you very much.
Thank you, Martin.
And now Victoria.
Thank you very much. Good afternoon, everybody, and thank you very much indeed to NHS England for inviting me to join you today. It's frankly great to see so many of you gathered here to get to grips with the challenges that we've been hearing about. So, Better Health for London, yet one of the reports that you mentioned that have come out. The report of the London Health Commission is an important document. Lord Darzi, the expert groups, Public Health England, the NHS, and, as Anne has said, an incredible number of people have contributed as stakeholders to this very important document. An unprecedented number of ordinary Londoners have helped shape this wide-ranging and exciting report. And as an observer to the Commission, I'm delighted to see so many of you here today, of all those people that we spent the summer with in various rooms across London. So Anne, thank you so much for showing the movie, because I don't need to do the rest of my speech, because you can see straight away the places we went to, the people we listened to, and many of the people are in this room. So thank you to all of them who gave up their time for what I hope is an absolutely groundbreaking report. But as I said before the report was published, it's not just the report. The report is just the beginning. The report is not the end, it's now our start. It's our call for action. It's our stimulus to action for working together. Again, to echo what's been said, this is just the beginning of how we can use all the work that's gone in to this and Simon Stevens' 5-year review report as to what we're going to do now. So the report invites responses and actions from a number of organisations representing the complexity of the care and health systems here in London. So, as both the previous speakers have said, it's now up to us, to what we're going to actually do about it. So Boris, as the Mayor, who I'm here representing, will be publishing a formal response early in December, and we'll look forward to seeing the responses from all the other organisations who've been invited to respond, with a stake in considering all their recommendations. And once all the responses have been made, we're then going to come together collectively to discuss how to take this forward. So moving forward to ensure that the momentum, the partnership, and all that energy we saw over the summer is maintained. So unsurprisingly, Lord Darzi and the Commission members found that there's a tremendous amount of good work going on already. The diversity, the talent, the energy, the dedication that we've seen. I've seen so many pioneers and exemplars of good practice across all of London. And so they're already trying to bring together the best of the care and the health system. And I think that was very much one of the messages that came forward, how we're going to work more collaboratively with the patient as the focus. From City Hall, we've developed and encouraged programmes to ensure that health inequalities, which is obviously our main responsibility as far as health is concerned, are being looked at as part of policy working, not, of course, just in transport and just in planning, which are the things that come to mind, but, of course, the other things that come together, like healthy schools in London, where we've got already over 1,000 schools signed up. Again, it's not just the food on the plate, but how we can empower those children to make the right decisions about their lives. In fact, I've come this morning from visiting a special school up in North London, which was the first winners of the Gold Award. And it's really good to see how, by an individual approach, we can try and help empower those families to help them help their children. And, you know, we're going to, I'm sure, talk about mental health at some point during this afternoon. But it's so important to make sure that we don't neglect that side of the school curriculum. At the GLA, we've developed the Workplace Health Charter, which supports employers to ensure their workers are healthy. And we're now working within 27 boroughs. And frankly, our challenge is to next sign up the NHS as employers to be accredited. So that's our challenge for the afternoon. We also deliver the Well London programme, which engages with local communities in their health, as well as working to highlight HIV and breast cancer and encouraging more people to be tested. Boris has produced a report on the economic analysis of the costs of mental ill health, and obviously that's a very important topic that we should be carrying through from the London Health Commission, and delighted to see that's going to be follow-up on that. So, for the Health Commission, the conversation with Londoners about their health and well-being, as we all know, has been extensive. So that now it's the next step to bring that all together and to make sure that the health and care commissioners should innovatively and energetically continue to engage with Londoners so we can continue to capitalise on that buy-in that we've seen and involve people in the future of their services. Boris feels very strongly that London should aspire to be the healthiest major capital city in the world. So I know that with the London Health Commission report and with the 5-year Forward Views report, we're certainly poised to deliver that. So the challenge and the delivery is in this room. So I look forward to working with you all to improve Londoners' health, and thank you again to each and every one of you who I know has worked incredibly hard on putting these reports and plans together. So thank you, as a Londoner, for your commitment to the health of London. Thank you.
Sorry. And to round off, Mark.
Thank you. So, thank you very much for asking me to talk today. I'll be brief, because I think the main themes have come through. There's no secret in the fact that we're all working together, and I could go on and on, because the only reason I'm here is because of the positivity that I've come across. I accepted this job only because everyone I've spoken with is so keen to make a change and make things move on. I'm chair of the London Clinical Commissioning Council, which even I struggle to get my lips around sometimes, which means I'm basically the representative of the clinical leads, which is mainly chairs of the London CCGs. They've been working together now for 2 years under Howard Freeman, who I've taken over from, and worked very closely and I think very effectively with NHS England. And that's why I'm absolutely delighted to be taking this role on. My other day jobs are as a GP, which I do a day and a half a week, and that's lovely because that keeps me in touch with reality sometimes. But I'm also chair of the Lewisham CCG, which you may have heard of, and has had some interesting relationships with NHS England over the last couple of years. I just feel this is the time now we can make a real difference in the healthcare that Londoners experience. I see this forum as a great platform, an opportunity for leaders across London to collectively address and respond to all the challenges that we have. A lot's happened recently, and I'm actually very excited and had just a tiny, tiny part in the 5-year Forward View that came out. And I think that, combined with the London Health Commission report, and from my point of view, also the strategic framework for primary care that is coming out, between them give us the tools and the chances to really, really make a difference and move things on. The GPs need to work with each other and clinicians to be able to fully work with specialist colleagues, social care, voluntary organisations, and this will help us. If we don't, then other organisations may help us anyhow, which is not, in my view, the best way forward. I've literally just now come from a clinical directors meeting in Lewisham, and we were discussing then how to change the hearts and minds of clinicians to take a broader view. Because from my career, I was taught you deal with the patient, you have your 10, 12, well, 6 minutes in my day to deal with the patients in front of you. We now take a practice view. Now we must take a population view, at least a CCG view, and in my case it would be a South East London view, and then building to the total London view. This sort of thing was touched on the Today programme this morning. A lot of it is about clinicians wasting money, over-investigating, doing everything wrong, and this has been, unfortunately, a theme that's come through endlessly. Clinicians are not the cause of the trouble, they are the answer to it. If we work with everyone and work cooperatively, then this is the way we can make things happen. The 5-year Forward View with the London Health Commission, Better Health for London, and the primary care strategy, they totally lay out the future of health and social care in London. And we must all have the courage to work together and the vision to work with each other and the people of London to make London the healthiest global city in the world. Thank you.
Thank you.